Okay, so the first thing that I'm going to be performing is the OA manipulation into lateral flexion. One of the main things with this, of course, is I want to go through all the red flexings, everything like that. A few things I just want to, constantly keep up with the patient, how they're feeling, doing, etc. And also, as key as we talked about last time, is watching the eyes to make sure nothing's kind of funky going on to there. So where I'll start off with, so I'm going to go into kind of a left opening technique. So first, have the patient supine, head either flat or onto a pillow, whatever is most comfortable for them. And I'm just going to kind of come under here, grab right behind the occiput, and then just kind of go down into just kind of to assess, just right into here. So take him into max rotation. Now, how does that feel right there? Good. Now I'm going to change my hand placement. So my other hand supporting under here. I'm going to take the palm of my hand, kind of come under the head right here, and I want that resting spot just kind of right on that process right there. So I'm going to come over, hold just like that, and just hold briefly, kind of tell them to open your eyes for me. Now, how does that feel? Good, good. So basically, kind of just keep checking it just to make sure. Always want to check and see what the patient feels like, simply because you can reduce a lot of your symptoms and not contraindications, but a lot of your adverse effects by simply asking that question. That's a little tidbit I gained from Peter Gibbons, a DO out of Europe. But so, come back again. Again, I'm going to come right there on the process. Go over contractions. Does that still feel okay there? So come in, just kind of assessing, introducing my FMAs right there. Kind of watching the eyes. Pull to that inner range. And just thrust right in there. The next manipulation I'm going to try is called the OA distraction. This might be a really good one, especially as you've seen the last one. There's a lot of rotation like that. So if your patient can't take that rotation, you can't take it to inner range, then this might be a very good one, because generally, outside of any type of ligaments, etc., traction is going to be very beneficial and very tolerable to the patient. So the first one I want to come under and just move my right hand, kind of come under and cup right there. I want to disperse the force because I just don't want to jam into the mandible there. And the second, I want to come under here. I just want to cradle their head just like that. Good. Is that comfortable? Well, not yet, but maybe. So right there, let me get a better grip. And I just want to kind of come up, and my thrust is going to be kind of pulling away just like that. So generally, I'm unilateral onto the left side with this one, but I'm going to come in here and test a little bit. Play anything there? Okay, good. So come up, and then just like that. All right, so the next one I'm going to try is the AA manip. We're going to go into left rotation as well. So I'm going to come over here, and of course you want the table about mid-thigh. I'm going to come under, make sure that they're comfortable. You can put a little bit of pillow underneath your head if you want to lift up a little bit. So what I want to do is first start off with rotation. You're looking at about 20 degrees of rotation. So go about there, and my second lever is going to be actually a little bit of lateral flexion, just cramming up that side. Once I get there, sheath the lock a little bit more, just relax on. So let's rotate there. So I feel pop in my hand, flex it there. And just like that. All right, so the next one I want to do is actually not manipulation, but a mobilization into OA flexion and traction. So, and this is one I do fairly often, especially if, a rule is probably not ligamentous or anything from an MBA and all the red flags kind of ruled out. So what I'm going to do is I'm going to come over here. I'm just going to come under my supporting hand, just kind of rest right underneath the occiput. And then I'm going to come under here. I'm going to get right about C1, just like that. And that way I can actually kind of feel where I'm going. So if I'm kind of pulling back in the traction and I blow right past that, well, I'm already at grade 4++. So for just kind of a bilateral, what I can do is just kind of come back here, grab a part of that, and go right into there. Just feeling for it. Now, if I want to go unilateral, since I'm going traction, I always can add a little bit of a side bend to it. Pulling back, I'm feeling kind of left more than the right. And then finally, if I want to get a little bit more of a specificity to it, I can always come under here. It's a little uncomfortable. Right now, I've got my hands right there at C1. So I can kind of block there and then come. And then I'm just getting that OA. So I can kind of pump mobilize there. Or if I want to get into a little bit of flexion, bring them up or even drop my shoulder into it to get a little bit more of an overpressure, which can sometimes feel extremely good, especially if there's kind of a lot of guarding, a lot of upper cervical extension. So next I'm going to try is for an upslope manipulation. I got the head supported a little bit, and generally you want to keep that onto the pillow. So what I want to do is if I'm going to be thrusting towards the left side, I want to stand a little bit of straddle stance, table about mid-high. And again, I'm going to use a couple of levers. So the first thing I'm going to do, if I'm going to do into the manipulation on the right, I want to rotate. So go, that's about C2, C3, C4. So I'm going to do 4 on 5. My hand's kind of right under here just to get the feeling of that. And I'm just going to rotate till I feel that kind of pop into my hand. Right there. And then I'm going to back off slightly. Come, and I'm going to down glide into that where I feel it kind of come. And then go into it. So left here. So, and then with this one, it's pretty mobile, I'm not getting. So I'm going to apply a couple of different levers here. So I'm going to come into a little bit of left translation. Go here. How does that feel right there? Just like that. So the next manipulation I'm going to do is a cervical down glide manipulation. So I'm going to come in here. So recently I just manipulated 4 onto 5. So what I'm going to do is actually probably go down a little bit to 5 onto 6. So go C2, C3, C4, C5. So again, my left hand is going to come, and with my thrusting knuckle just be there right on the articular pillar. And so what we're going to do with this one's just a little bit different. But I'm going to laterally flex, actually, to start off with. Right till I feel that kind of blow past me and just back off. So right there. And then I'm going to go into lateral flex down to the left, and then I'm going to go into right rotation. Any pain right there or anything? Good. Bring my elbow down a little bit. I just lost it. Good. Any pain there? Go here, a little translation. Go just like that.